Hello, welcome back. Diaz here, founder and owner of Greenwood Dental. Welcome to my series, What's Up Doc? Today I decided that I want to confess about my knowledge in regards to holistic dentistry. And the reason for that is I've been debating and, trying to be very careful to address the subject of that kind of practice. But recently I've been being approached by a lot of new patients. They're trying to find a new dental home. I guess after post-COVID, a lot of the dental offices have shut down, whether they're sold to a DSO or some of the dentists that have been practicing holistic dentistry have retired. So we've been getting an influx of phone calls wondering if I am or I do practice holistic dentistry since I've been, used to it for the past 20 years. I've heard about holistic dentistry through the years, and I never really got into reading about it, or I never got into really understanding the difference between a general practice and a holistic dentistry. But recently I've been reading and Googling it, so here we are. So my confession today is what I know about holistic dentistry and what makes it different between general practice dentistry. I don't know the best way to put it, really. So holistic dentistry, it sounds like to me, and correct me if I'm wrong, it sounds like to me from my understanding, everything that I've read, is they approach your mouth they approach the patient as a whole body. So they look at your chemistry, the whole body chemistry, they look at your habits, they look at your of course medications, they look at the stress levels, which affect dryness of the mouth, affects your mood, affects your hormones, and so forth and so on. So they don't just focus on the condition of the tooth per se and then tell, okay, this tooth is broken, you need a crown, you need a filling, or you have a cavity, you need a filling. They really try to interview you and sit down with you and trying to know you as a person and trying to navigate or understand how your body is working and why the things that are happening in your mouth are happening, and they move on to the diagnosis. They do practice preventative dentistry, meaning that they do ask if you're interested in balancing your chemistry, if you're interested in doing some preventative measures to avoid or prevent certain conditions instead of just waiting for the condition to happen and then be in a situation that's like an emergency situation. They have to fix it, and the ticket price goes up and up and up the bigger the emergency is. I'm sure a lot of you know, or a lot of you, or many of you have been in a situation that I need, this fixed right now because I'm in a pain situation, or, I can't chew on my tooth, and you have to cough up X amount of money to fix it, basically. So my opinion, what do I think? I think it's a great, way to practice. I think it's absolutely necessary these days because our life is a lot more hectic. We are faced with a lot of different diseases. Autoimmune disease is through the roof. Depression is through the roof. Addiction is through the roof. Not necessarily drug addiction only, but it's addiction to screen time, addiction to soda, addiction to fast food, addiction to alcohol, addiction to caffeine, addiction to processed food, gluten, sugar. There's so much that is around us, and we do it every single day without realizing the damage we cause on the body, and as a result reflects on the mouth. Now, do I practice holistic dentistry? I don't advertise it. I don't advertise that my practice is limited to holistic dentistry. I don't have a spa. I don't have tea or coffee in the waiting area because I don't like that term. Waiting area meaning an area that you sit and wait. In our practice, our brand, if many of you are listening or watching, you'll know that you don't really wait. And we do our schedule accordingly. I don't have a, you know, they say they give you like an moisturizing oil for your lips so it can enhance the, you know, lubrication so you'll be a lot more comfortable. We give a lip balm like away, you know, with our logo on it. I guess that counts like it. You go in at our practice, they have pillows and blanket. We do that for some of the geriatrics patients and the seniors, or some patient walk in with their own pillow if they have back problems so they can sit you know, more comfortably. They do say that they do conscious sedation. I've done conscious sedation the first 2 years of my practice or my career in Maine. And that does include pharma. So it's diazepam, it's Valium basically. And they do monitor the pulsometer that they hook to your finger. It's you know, anybody can get that, but they do advertise that it's hospitalized setting. It's not hospital setting. All you need to is monitor your heart, your pulse, and your blood pressure. Basically, you just keep your blood pressure cuff on you, and then we do that with when we do nitrous. They do say that the medication that they use is very, very safe. Yeah, diazepam is safe, and you titrate it through every half an hour. I've done that, like say conscious sedation, you have to be certified. My thing is, the contradiction is you are holistic dentistry. And from the patient that they have talked to about holistic dentistry, that they don't do root canals. Root canal is a big no-no because it's the filler of the root canal is a toxin. It's a plant-based, it's not a toxin. The sealer of the root canal, and they don't do root canal, they treat the tooth holistically. I'm very vague on what that means, because if you're giving pharma medication for conscious sedation, so you can, obviously you're doing treatment, right? Well, why are you putting patient under medication for conscious sedation if you're not doing dental treatment? So you're using pharma, but pharma is not very naturopath approach to things. But there's nothing naturopath about dentistry, unfortunately. If you have an infection and you have an abscess, that is toxicity in the body that produces from fighting the infection. You have to drain it. You have to get rid of it. Either you cut it, excise it, drain it, you know, you do incision drainage, or you give the patient something for it to drain. Otherwise, it becomes very dangerous. And I'm going to make another video about a story that happened to one of my siblings recently. But so the contradiction is you're giving pharma for conscious sedation. I know you do. I know you are. But at the same time, you're encouraging patient not to approach the infected tooth and abscess tooth with a root canal to drain the tooth and seal the tooth so can save the tooth, because it's not holistic. That, it doesn't make any sense. I know that for a fact because I have a patient that left our practice because they did not agree with the treatment recommended for an infected tooth as a root canal. And I have a patient that called looking for a new practice as long as we don't recommend root canals. So I have a patient that is had an infection on a back molar and it's pussing out, it's draining. She won't even take antibiotics because she said when she takes antibiotics, she has an out-of-body experience that really freaks her out. Well, you might be sensitive to the antibiotics, or maybe that's not the right match, the type, you know, match of antibiotics to your chemistry, but you need to do something, whether it's an invasive procedure or it's prescription based. You have to get rid of the infection. If your body can get rid of infection, it would get rid of the infection by itself. But obviously, when you reach out to us, that the body hasn't really successfully done that on its own. So I know I'm gonna run out of time because it's a huge subject and it's a huge trend. It's we've been constantly approached about, you know, by patients. And I wanted to do that video and send it out there to let you know that in our practice, we do treat the whole body. If you are a patient of ours, please put comments on the bottom and let them know. We ask about, you know, who you are and what you do every single day before we even look at the mouth. And that is the right way to practice. And I'm glad that the practices are getting into the trend even more and more. because that's very important. We are avoiding the disjointed concept between the head doesn't belong to the body. The head is a reflection of what's going on in the body. I'm out of time again, but catch me on the next video. I'm sure I'm going to talk about this again, and I hope you guys enjoy it. Please subscribe, push that notification button, and please share. And you guys have a great day or night, and I'll catch you on the next one. DS out.